Like to introduce Lynne Woolley, who is the head of Young People and Family Services at Versus Arthritis, which was one of the charities involved in the research. And Lynne's going to explain a bit more about the other partners and the research and some of their findings. So welcome, Lynne.
Thank you so much, Kat. Thank you so much for inviting us along today to talk about at this amazing conference. I've really enjoyed the presentations today already, and I hope that you enjoy this presentation too. I'm just going to share my screen. Okay, thanks very much. My name is Lynne Woolley, and I'm the head of the Young Service at Versus Arthritis, but I'm actually here today representing a really unique collaborative charity-led working group which involves a number of charities, some of whom are on the call today. Thank you so much for coming along, for the moral support as well, and also Sammy Ainsworth, who's on the call and will be speaking a little bit later on in the presentation as well. I'm going to be sharing insight from a recently published research piece into the scale of mental health concerns for young people and families who have a child or young person with a diagnosis of Juvenile Idiopathic Arthritis, or JIA. The research is incredibly important. It underlined the urgent and vital need for timely, age-appropriate and accessible mental health support. And we wanted to share the results with you today and spark a bit of a conversation about what we can do together in partnership, as well as through campaigning for change as a group of really engaged stakeholders to address some of the findings from the research. And whilst this research is specific for JIA and it was a UK-based survey, we do really feel like the findings are really relevant for other nations and other countries around the world too, and also for other conditions. I mean, we've spoken to a few other charities with other long-term health conditions about some of the findings of this, and some of this really rings true for them as well. So just to add that little bit of context there. So the research was initiated originally by 5 UK charity organisations working with families affected by JIA. We had the Children's Chronic Arthritis Association, CCAA, Juvenile Arthritis Research, SNAC, the Scottish Network of Arthritis in Children, NRAS, JIA, the National Rheumatoid Arthritis Society, and also Versus Arthritis. We had the support of BSR, and we were also joined by Lupus UK and Sammy Ainsworth later on in the project as well. I will be forever grateful to the amazing Polly Livermore, who explored and developed the survey findings for us. We received nearly 300 responses to the survey, and it was a huge amount of work for a group of charities to look through. And we appreciated Polly's support into turning that insight into something that we could publish and share with others, and to NRAS, who led on the survey logistics and made sure that it was possible for us to run that survey. This collaboration came together because as individual charities, we were supporting young people and families across the UK, and the need for accessible and timely health support with mental health and well-being was coming up time and time again with the families that we were working with. And in particular, it felt even more pertinent because we'd just gone through COVID at that time, and many of our families were facing isolation and talking about some of the difficulties they were having in accessing support and care, and feeling like some of those issues had escalated during that time in lockdown. And we were trying to support and advocate for for better care and treatment for some of those families, and also trying to stretch ourselves as a group of charities to provide more support. But it was feeling like it was more complex this side of COVID, but also just an increasing demand to stretch ourselves further and further and faster. So we joined forces to do something about it. We wanted to find out more about what our families and young people were experiencing, as well as the scale of some of that need. We already had some historic research that gave us a few pointers into what might be happening, but we wanted to have a look at this afresh, take on board new insight and improve the support we could offer. But we also wanted to understand a bit more about some of the barriers and challenges being faced by our families and young people, and think about what we could do to drive improvements in the care and treatment on the ground. We created a survey, and parents, carers of a child or young person with JIA or a young person aged 13 to 18 kindly gave their time to self-fill in against 19 questions on an online questionnaire, which had a focus on mental health impact of having and living with JIA diagnosis. So this was for everyone that had a formal diagnosis of JIA. As I mentioned before, we had nearly 300 responses from across the UK, 229 from parents and carers, 44 from young people, as well as some young people and their parents, carers filling it in together. And the median age of the young people responding was around 12. What we found was that around, just in terms of how long people have been diagnosed for, about 35% of those responding have been diagnosed for longer than 6 years, and 14% within the last year. So we had quite a spread of some people that had been living with JIA for quite a while, and others that were quite recently diagnosed in the last year. And so the key findings from the survey, this is probably little spoilers because I should probably do this as the final slide, but I'm going to say them up front so you've got them in mind, that nearly 60% of our respondents had or are requiring mental health support. And this is higher than some of the previous research that has been looked at, but we also took into consideration that that this was an open survey that anyone could fill in, and maybe people that had more of an interest in this area responded, but it was much higher than some of the previous research percentages had suggested. We also had significant numbers of parents and carers reporting difficulties in accessing care for their children's mental health or their own mental health due to their child's diagnosis. Too many of the families in the survey responding were going without adequate, timely and tailored mental health care support. And it really underlined the importance of promoting good mental health, and that should always be part of a general rheumatology medical care on a par with physical care that's given. And there was a real need to resolve inequity. So for some of our families responding, they had a lot of support and wraparound care from their centres, but in other cases that wasn't always there, and some people were receiving support in community settings but not in other areas. And there were some discussions about why there were those differences and how we'd ended up with a situation where some young people had access to a psychologist and others didn't within their rheumatology teams. And there was a lot of feedback as well about what worked and what was having an impact, and just underlining that when we get it right and when the system gets it right, that led to good outcomes. So the overall finding was that to improve the lives of children, young people and families, timely and accessible access throughout the life course and individuals' needs is vital. So that shouldn't be a one-off intervention that finishes and that's it. This was very much about supporting someone throughout life, particularly a young person diagnosed early that then goes through transition from paediatric to adult care was one of the themes that came up around transition. And the early intervention and prevention is key. So really helping to equip people and young people and have those tools and support ready to go for when they need it. And providing people with some of those prevention tips as well was really, really important. So a bit of context for those who might find it useful. So just in terms of the current situation with mental health and wellbeing in the UK, that the Mental Health Foundation reported that 75% of young people were not getting the help they needed in 2021. 50% of all mental health problems start before the age of 14 and 75% before the age of 24, according to the research of Kessler from 2005. And in relation to long-term health conditions, at age 15, young people with chronic health conditions are 60% more likely to be diagnosed with mental health needs than peers without a condition. And that was from a 2020 study. And just in terms of what the current data is telling us in the UK, so this is from England only, unfortunately, but in 2017, rates were around 1 in 10 of a probable mental health need. By 2019, we were 1 in 6. And the latest stats for 2023 were released yesterday. We're now at 1 in 5. And although the age ranges are slightly different, actually, they all progress up into this space. And this was yesterday's report, and just underlining that it shows unprecedented pressures facing young people and an increase in demand for these services and support. And that's for the general population, that's not for children and young people living with long-term health conditions. We have standards of care in place for JIA that have clear aims around providing holistic support. That was one of the reasons the standards of care was put into place, was to make sure that there was a holistic approach to care that brought lots of different professionals together. And there was a real focus on psychosocial outcomes in addition to control of disease activity. And these two key points here particularly mention the need for clinical psychology and psychology support. So we have the standards of care that says what good should look like in the UK already in place. But we also know from survey work and campaign work from the British Society for Rheumatology that although 68% of paediatric and adolescent rheumatology departments said they had a psychologist, that could often be as little as 0.1, so 4 hours per week available. And the State of Play 2019 report from the BSR recommended that there should be an increased provision and focus on psychology support across rheumatology clinics and through both one-to-one work and group sessions as well. So you've got the kind of growing need and demand, you've got the workforce, lack of workforce support, and then you've got feedback from families and children as well. So in terms of our survey results and what they kind of told us, we found that 59% of the families responding to the survey and the young people responding to the survey have had or are having or were waiting for mental health support. And as I mentioned before, that was much higher than maybe some of the previous research studies had highlighted in terms of the level of need. A further question specifically asked of these respondents was if they had mental health support needs from, if they'd received mental health support from somewhere else outside of a rheumatology clinic. 50% said no, and 30% didn't need the support at that time or hadn't needed that support, and 20% had received support. So that's quite a big percentage of people that hadn't had support from outside of their rheumatology clinic either. And sorry, I've moved my notes around and they're in slightly the wrong order, but now I'm back on track. So, and we asked, had young people been offered mental health support during appointments? 54% said no, and 36% said yes, and 10% were unsure. And then when we asked them if they'd been offered support outside of rheumatology clinics by community care and support services, 50% said no, and 20% said yes. And in terms of where did they get support from when they weren't in their rheumatology care, if it wasn't from their rheumatology care. So here we had the highest number was from CAMS. Around 70% of people said that if they'd got support outside of a rheumatology clinic, it had been through CAMS. And then close behind that was school and college. Art therapy was also mentioned in here, as were wider support sessions as well. So that was some of the insight into where were people getting support where they needed it. It was a bit of a mixed picture on the support, so we did have some open questions. And sometimes the support being received was supportive and helpful and had made a positive impact and reduced the impact of some of the issues faced. But in other cases, the support had been too short term, had not been specific enough for condition, or too generic, and some of the support services hadn't really understood what it's like to live with arthritis. And some of the key problems faced, which I'm sure for those of you that do provide art therapy around JIA, these will feel very familiar, but there was 80% felt that worry about injections and had had a problem at some point around that during their after their diagnosis. 80% felt really concerned and worried about taking medications at some point in the after their diagnosis. And there were a lot of questions on the sort of why me and feelings of being different that occurred at a significant number. So that was 75 and 73% of the young people and the families responding felt that that was a those questions kind of came up a lot for them and were one of the key problems that they faced and wanted support around. We did break down the young people's and parents' answers for this one, and there were quite significant differences in some of the stats, but similar in other places. So, for example, 27% of parents had said that school had never been an issue, and feeling part of school and thriving at school had never been an issue for young people, for their child or young person. But actually, young people had placed it much higher, saying only 5% of them said that school had never been an issue. And we had some similar ones as well. Young people were more likely to be worried about the future. Their parent, they would flag that as like a 41% of them were worried about the future and wanted some support around that, whereas only 27% of parents thought that their young person or child was worried about the future. So there are some differences there between the different responses. And one of the other things that the survey looked at was the impact on parents and siblings and the wider family. So we asked, have you experienced mental health issues following a JIA diagnosis for your child and young person? And 82% of parents said that they had, and that there had also been an impact on siblings as well and their mental health. And despite saying that 82% of parents and carers had experienced mental health issues, only 14% of parents said that they'd been able to access any mental health support to help them. So I'm going to hand over to Sammy to talk a little bit about her journey and taking part in the research.
Hi, is it my go now? Am I live? Oh, hi, there we are. Yeah, I'm looking at myself now. That's not good. Thank you very much for asking me, Lynn. It's been really, really good to work with Lynn and the rest of the collaboration. As Lynn mentioned, I've got always have a few different hats. I'm trustee and currently the secretary of Lupus UK, and have been on the board for quite a few years now. And I'm also the chair of the much smaller charity Raise that was set up by my daughter Sophie, that looks at and tries to support invisible illness in schools and education, and young people affected by issues around that. So we did a webinar as part of our wider work with the survey, and Lynn and a couple of the others asked me to talk about sort of mental health in parents, because it was something that had quite affected me following Sophie's diagnosis. Sophie was 14 when she was diagnosed with lupus at Alderhay. And like many mums, I did what we all do, and I sort of swooped, and many parents, I swooped into sort of action and tried to wrap her up in everything I could and support her. But what I forgot was to look after myself. It just didn't even feature in my plan at that point. It was just all obviously about my daughter, and to try and slowly build her up again following that diagnosis of lupus. So for about 2 years, she was in and out of Alderhay. Thank goodness she was, because she had absolutely excellent care there. And it was probably coming to the end of that 2 years when she had about a month in hospital, in and out. We were like Jack in the boxes, and we lived about an hour and 20 minutes from the hospital. It always involved big, long, desperate dashes. It was incredibly stressful. She was having all sorts of tests for lots of horrible, scary sort of lupus side effects. And basically we came out of hospital, and just as she got on an even keel, I just felt like I'd fallen off a cliff with exhaustion and just complete stress, basically. But luckily the hospital had a fantastic psychologist that was there for, most importantly, the young people and the children, but also for the wider family. And that psychologist probably really sort of started to pick me back up again and to help me have the confidence to try and start to put myself back together. And I suppose probably I learned one of the biggest lessons probably of my life, that if I wasn't okay, I certainly wasn't going to be okay to support my child. And I sort of try and use that now with my grown-up adult son as well, who is fit and healthy. We have to, as parents, look after ourselves to make sure that we're in a really good place. So listening this morning to some of the amazing presentations, I just kept thinking how I would have loved some of that therapy, that art therapy from an adult perspective. It just sounds absolutely amazing. But what the psychologist at Alderhay did, and I'm very, very lucky that we have that facility at Alderhay. Lots of places don't. was that it really just gave me time to sort of have a separate appointment in a really, really calm and welcoming and safe feeling place to go and talk about all the worries and the concerns that basically I wasn't talking to anybody about. But what it also taught me was to try and almost to sort of pick my support network away from that place. So I soon realised who were the family and friends that I did feel that I could really talk about sort of my worst fears to. Because when you're the mum of a young person with a what's going to be a lifelong chronic condition, there's an awful lot of them. So 10 years down the line, I'm in a much better place. Although there are still many, many times when those fears do pop back, normally in the middle of the night. My daughter's 24 now and working full time and has gone through university. But we've tried to support her mental health, but I also always try to support mine as well. So being part of this really interesting and hopefully impactful project with Lynne has really sort of made us all think. And I think we've probably got lots of next steps that we all want to explore. I think I'd really want to look and delve maybe a little bit more deeply into the impact on sibling mental health and also the impact on the wider family's mental health, because, you know, we are really all in this together. But I think maybe the final sort of take home is that without the amazing charities that I know Lynne and I work with and places like the Teapot Trust, I think would be in a lot worse a position than we are. And I'm really, really grateful to that. So so thank you for then just letting me have a little snippet within your study. But it's been an amazing day, and thank you so much for inviting me today.
Oh, thank you so much, Sammy. I really appreciate you coming along and sharing your experiences and talking about some of your reflections on what's helped. And just to reiterate that, I mean, that came out very strongly, and I'll come on to it in a couple of slides, but just about the important role that charities have to play alongside healthcare teams in providing support and guidance through, for example, art therapy was mentioned quite a few times in what's worked well for you, what's had a positive impact for your family's mental health and well-being. So thank you very much, Sammy. I really appreciate that. So I'm just going to share the final few slides for this section, just to finish off what that looked like, what the recommendations were. So we had quite a lot of open questions as well, where people could write like just anything they wanted to share with us, maybe things we'd missed in the survey that haven't been picked up. And we kind of categorized those into 4 areas. So there was one around gaps in care. So this was around lack of timely care, lack of holistic care, lack of information available and trying to find information online and not knowing what was right and what was true and what wasn't. The impact on the family, which we've already touched upon there. Social impact around the impact on education and employment and peer relationships, and future was really big as well. And we also sadly had a small number of families as well that flagged that because they hadn't been able to get the support at the right time, that had led to crisis mental health needs that could have potentially been prevented with an earlier intervention and prevention approach when they'd flagged issues originally. So they were some of the themes that came through the qualitative sections. But families also told us a lot about what worked. So receiving helpful information, family days, the opportunities to come together. I think that was something that Megan talked about in the presentation before lunch, was about the importance of allowing young people to come together and chat and get to know each other a bit. That peer support really helps. Art therapy was mentioned in there alongside other things around sports and staying active and community work. Youth work events and youth events to know that you're not alone. Psychology support in rheumatology teams, embedded in rheumatology teams, we have a few, but it's not consistent across the UK. Access to support from healthcare professionals, both in your community and through school and other forms that with the support that they need to understand what it's like to live with a long-term health condition and provide more bespoke support rather than generic help. And access that timely specialist support. So lots of families reflecting, well, I'd received this at this point and it really helped at escalating any further, with some of the key themes that we found. So as Sammy mentioned, as a group of charities, we decided to focus initially on providing some support to plug some gaps that we'd seen in the survey. So we ran a wellbeing webinar that was attended by 70 families earlier this year. It's now on YouTube, available for free, and we were very grateful to the 2 clinical psychologists who gave their time and skills and knowledge to share with parents. And we've also written up some blogs and vlogs around those so that people can access that support wherever they are in the UK or the world. We've also got a charity info sheet with the support that we offer as a group of charities listed in it, which I've asked if Teapot Trust can send out afterwards in case anyone would like to know how to refer young people and young adults to our organisations. Each charity has its own support tools, resources, mental health hubs and wellbeing hubs on there, which is really helpful, useful source of information for families and for young people as well. We've also been developing some of our own films and videos. Oh, I think this is about to play, so hopefully you can hear the sound on this one.
Arthritis makes me very frustrated, and some students say, oh, you're faking it, or oh, you can't have it, it's old person's disease. I just kind of ignore it, but it just kind of gets me upset as well at the same time.
I was the student who kind of stood out, like no one had seen it before, no teacher had experienced a child with that. Trying to cope with being in pain, it's quite hard, so I struggle with low mood, but I find school actually is a great distraction.
When I was first diagnosed, if you'd asked me like any questions, I'd burst out crying for a good like 2 years. I was young and like the emotional side of it was just so much, and I wouldn't really know what was happening to my own body.
I would say it makes me feel quite self-conscious because if my things lock, it's not the prettiest to see. It's quite ugly and it's quite mentally straining, which I don't think people realise. Some people, this was when I was a bit younger, they would think it's like contagious, and you're just kind of there like, well, it's not. So people try and avoid me, and you're quite worried whether people will actually not like you. So not for your personality, but for like your condition. And my personality isn't my condition. The snidey comments kind of, it doesn't make me sad because I try and not let it get to me. I shouldn't, but some of them can make me quite upset, thinking I'm not normal. I think I'm different to everyone else.
I'm very self-conscious about the way I walk because my arthritis obviously gives me a bit of a limp. So, and I have had people ask me about my walking, which kind of just makes me more self-conscious.
I'm worried people view me in a different light and don't invite me to stuff because of what I can't do.
Don't be embarrassed or ashamed of your condition because it's not your fault, and don't be scared to tell people because once you've told people, you can get more support and it'll become easier for you to manage. So it's the best thing to do.
Communicate with your parents and teachers if something has gone on, because otherwise that's just going to carry on happening and there's no point keeping it to yourself, which is quite bad for your mental health and stuff.
A person with this condition should openly talk about it and not feel like it's a drawback or people would not like them for their condition, because I think people can actually love them for a condition. The fact that you've gone through it at such a young age, it shows how strong you really are.
No, it's quite nice to be able to have friends you can like laugh about it with, and teachers as well. Like if it's someone that you're comfortable like joking about it with, like they always say laughter is the best medicine, but it actually is, and it can take your mind off the pain.
So important.
Yeah, so
The most important thing.
you need to be so open about it. I find like I have this one teacher at school that I completely trust, and I always talk to her about how I'm feeling, and I think it really helps your mental health as well.
I think it's good to know that like we're all kind of going through the similar thing, so like to know each other and know like medication and like how to cope with things. Like I think it's so important to like have each other.
And also like reaching out to charities like Versus Arthritis, because they have helped and I've been able to meet other people to just know that you're not the only one.
Stay as positive as you can. Don't let it affect your life. Like don't walk around and be like, yeah, I can't do it, I have arthritis. The world is your oyster. Live it how you please live it. Don't let your conditions get in the way. Obviously the most important thing is to talk about how you're feeling. You know, it's okay to get upset. I get upset a lot, I cry a lot. It's frustrating, it's annoying. You feel like you've lost your old life, you grieve for your old life before you got ill, but talking is the biggest thing that's helped me.
So sorry, I've been struggling to get it to play all week, and then it just started to play straight away. So apologies I didn't give that the introduction, but this was about using some of the insight from the research to work with a group of young people to develop new tools and resources. So this one is about a schools resource for helping schools support young people with mental health and wellbeing. And I know the various different charities that have been involved in this project have also been embedding more mental health and wellbeing support in all the resources that we're currently creating at the moment, so that, as Sammy said before, the important role that charities can play in supporting our families, taking forward that research and fill the gaps that we found through that. But it's not just about what we can do as well as unique partnerships. It's also about what we do next, and we're really keen as a group to look at campaigning for improvements. We know that there are big workforce gaps and inequity of care in this area. We know that there's some really good practice out there that we could pull together and make a case for support, whether that's embedding psychology and pediatric rheumatology or other tools and techniques and interventions that we can do that might work well for some of the young people who responded to our survey and said they needed more support. We'd absolutely love to hear from you as a group of charities and get involved in this. I've included our email at the bottom to get in touch with us through our administrator at Versus Arthritis, kind of coordinates on behalf of all the charities, but you can also touch base with any of the charities mentioned here today as well. And just thank you very much for this opportunity to come and share our research and to share some of the things that we've been doing as well.